Thank you, Devin. And you may have heard someone say, I feel like pulling my hair out over this project. However, some people with trichotillomania, TTM, they are literally pulling their hair out. And here to help you identify this disorder and give you ways to stop the behavior is our very own Nurse Christina Pearce. Thanks for joining us this morning.
Hi, good morning.
Yeah, an interesting topic today.
Yeah.
Didn't know there was a name for this.
Yeah, there is. And it can be quite troublesome for those who have this disorder.
Yeah, no, let's dive right in. Okay. So exactly what is TTM and how is it diagnosed?
So trichotillomania is what it's called. It is a disorder where people will literally, like you said, pull their hair out. Oh. It's a type of obsessive compulsive disorder. And so, when we think about grooming, that's something that we do that can be very comforting. And so for those with anxiety or with OCD, will have some sort of trigger, so something that causes a lot of stress, and then they will impulsively pull their hair out, and then that gives them some sort of satisfaction. Now, there's some people will do more of a focused, where they'll stare at themselves in the mirror. Maybe they have body dysmorphia, where they'll see a hair and they'll pull, and they can be in the bathroom, in the mirror, and lose track of time. Then there's others who it's more habitual, so they're not thinking about it. Maybe they're working on a school project, or are at work, and so they'll just start kind of pulling their hair out. I've had several friends that have had this. It's more common with women, but men do it as well. I had one friend who pulled out all of her eyebrows. Another one who had bald spots in the back of her hair, and so they would learn to, comb their hair over, get wigs. You can do different things, but it can cause quite a bit of emotional trauma.
Yeah, so you talked about, thankfully, some of what this is. Now, what are the sort of the symptoms? I know you talked about pulling out the hair in the back, some patches and stuff like that. Are there other things to look out for as well besides, is it only hair related?
No. In fact, people will do skin picking, although that's like what is that? Dermatillomania.
Dermatillomania.
So you're talking about skin pulling. There's some that will chew or eat their hair. And so some of the symptoms, you're going to have, of course, the repeated pulling of, like I said, eyebrows, hair, things like that. Increased sense of tension prior to doing these things. And then a sense of pleasure after or while it's occurring. So you're going to have some hair loss. That's kind of easier to see more with the shortened hair, and so people will be very self-conscious. Pulling specific types of hair. So some people will pull the same thing, like they'll pull their eyebrows out. I know Miracle on 34th Street. I always think of that with the psychologist there who's, trying to evaluate Santa. He's pulling his eyebrows. That's, a type of a symptom. Experience a great deal of distress at work, feeling maybe that negative because you've pulled your hair out. So maybe negative feelings in your life, your social work, things like that will cause that anxiety. And so you get a sense of by causing discomfort with yourself, it actually eases the comfort emotionally. And then there's other mental health conditions, like I said, the body dysmorphia and things like that can cause it.
So those are some of the root causes.
Right, or symptoms too.
Symptoms as well.
That's what you'll see. That's how you can kind of identify. And as far as diagnosis, it's just going in and talking to your provider about this so that they can get you the help you need. But it's hard because many people don't seek help. One, they feel like they're the only ones that have it. And you and I were even talking about little things that we do. When I'm driving, I tend to kind of pick at my, at my nails. But some people will, it's more severe. Like they bite their nails all the way down. They pull their hair out to where there's big patches. So little things that you and I do are probably a little more insignificant than somebody who actually has the disorder.
Yeah, no, I used to bite my nails when I was a kid, but then, I was just telling you, you get braces, and then, I'm sure everyone at home can relate to this. If you have braces and you're biting your nails, that hurts. So you stop that real quick.
Yeah, and that's a really good point. So some people do experience this, you know, in their youth, but then outgrow it, while there's others that continue to have it lifelong. And so the things that you would want to do, of course, is talk to your provider about that, because there are therapies that you can do. So they, like habitual therapy training that they can have you go through. There's medications you can try, like antidepressants and antipsychotic medications that can kind of help with that, bringing down your anxiety level, your stress level can help with those sort of things too. So there is help for it. It will take some time, and you will need to purposefully seek out that help.
Well, that's great to know that this is something, because, you know, a lot of people think this is, you know, oh, it's just a habit.
Right.
You know, it is actually something that you can work towards, you know, breaking as well.
Right. And there are many people out there that have it. And if
I can think of a dozen in my head probably right now.
Yeah, and if you just Google search it, you know, there's all kinds of help out there for you. So don't think that if you do this, if you have the bald spots, if you've chewed, or if you pick your skin or pull your hair out on your legs, that you are alone. There are a lot of people.
Absolutely. Well, thanks again for coming on in this morning. Always appreciate your visits.
Yeah.
You know, real insightful stuff.
Yeah, glad to be here.
Well, thank you. And coming up,